Hello everyone, and welcome to our learning community. Here, we share medical education and MCQ practice to help you succeed in international exams. Each video is carefully designed to build understanding, inspire success, and make learning enjoyable. Together, we grow and create a brighter future. Anatomy of the bones of the upper limb. The upper limb skeleton is a remarkable structure designed for mobility, precision, and dexterity. It allows us to perform both powerful movements, such as lifting and pushing, and fine motor activities, like writing or suturing. Anatomically, the upper limb is divided into four main regions. 1. The shoulder girdle, consisting of the clavicle and scapula, connecting the upper limb to the trunk. 2. The arm, containing a single long bone, the humerus. 3. The forearm, formed by the radius and ulna, and the hand, made up of the carpal, metacarpal, and phalangeal bones. Let's explore each of these in detail. Clavicle. The clavicle is an S-shaped long bone that acts as a strut connecting the upper limb to the axial skeleton. Articulations. Medially with the manubrium of the sternum. Laterally with the acromion of the scapula. Key features. Shaft gives attachment to the subclavius muscle. Conoid tubercle and trapezoid line, attachment for the corticoclavicular ligament. Inferior surface for the costoclavicular ligament. Muscle attachments: pectoralis major, deltoid, trapezius, sternocleidomastoid, and subclavius. Ossification: the first bone to ossify in the body by intramembranous ossification, with secondary centers at the sternal end. Clinical note: most commonly fractured bone, usually at the junction of the middle and lateral third. Malunion can restrict shoulder movement. Scapula. The scapula is a flat, triangular bone located on the posterior thoracic wall. Key landmarks: spine of scapula divides it into supraspinous and infraspinous fossae. Acromion articulates with the clavicle. Coracoid process, attachment for ligaments and muscles. Glenoid cavity, articulates with the head of a humerus. Subscapular fossa, origin of subscapularis. Borders and angles, superior, medial, and lateral borders. Superior, inferior, and lateral angles. Ossification, body and secondary centers in coracoid, acromion, and glenoid cavity. Clinical note: scapular fractures are uncommon and often associated with high-energy trauma. Injury to the long thoracic nerve causes scapular winging due to paralysis of serratus anterior. Humerus. The humerus is the largest bone of the upper limb. Proximal end. Head articulates with the glenoid cavity. Greater and lesser tubercles. Attachment for rotator cuff muscles. Intertubercular sulcus for the biceps tendon, with attachments for latissimus dorsi, teres major, and pectoralis major. Shaft. Deltoid tuberosity for deltoid insertion. Radial groove transmits the radial nerve and deep brachial artery. Distal end. Capitulum articulates with the radius. Trochlea with the ulna. Medial and lateral epicondyle serve as origins for flexor and extensor muscles. Clinical notes: surgical neck fracture, axillary nerve injury. Mid-shaft fracture, radial nerve palsy. Medial epicondyle fracture, ulnar nerve injury. Radius. The radius is a lateral bone of the forearm, shorter but functionally dominant during pronation and supination. Upper end. Head articulates with the capitulum and radial notch of ulna. Neck is a common fracture site. Radial tuberosity, insertion of biceps brachii. Shaft. Lateral convexity, attachments for pronator teres supinator and flexor pollicis longus. Lower end. Styloid process, attachment for brachioradialis. Ulnar notch, articulates with the head of ulna. Clinical notes: Cole's fracture, distal radius with dorsal displacement. Smith fracture, distal radius with volar displacement. Ulna. The ulna is the medial bone of the forearm and forms the major articulation at the elbow. Upper end. Olecranon process, insertion for triceps brachii. Coronoid process, insertion for brachialis. Trochlear notch articulates with the humerus. Radial notch articulates with the radius. Shaft. Interosseous border gives attachment to the interosseous membrane. Lower end. Head articulates with the radius. Styloid process attaches the ulnar collateral ligament. Clinical note. Montagia fracture. Proximal ulnar fracture with dislocation of the radial head. Bones of the hand. Carpal bones. Proximal row. Scaphoid lunate triquetrum pisiform. Distal row. Trapezium trapezoid capitate haymate. Mnemonic. She looks to pretty try to catch her. Clinical note. Scaphoid fracture risk of avascular necrosis. Pisiform is a sesamoid bone within flexor carpi ulnaris. Metacarpals. Base articulates with carpals. Head forms knuckles. Provide attachment for interossei and lumbrical muscles. Phalanges. 3 in each finger, 2 in the thumb. Allow fine digital movements. Clinical notes. Mallet finger. Distal phalanx injury. Boutonniere deformity. Middle phalanx injury. Finally, let's discuss bones based on their structural classification. Compact bone is dense and solid, forming the outer layer of bones. It provides strength and support. Examples include the shafts of the humerus and femur. Cancellous or spongy. Bone is lightweight and porous, found inside bones. It contains red bone marrow, which is responsible for blood cell formation. Examples include vertebrae and the epiphysis of long bones. Bone develops from a hyaline cartilage model by endochondral ossification. First, a cartilage model forms. Then, it grows as chondrocyte enlarge. Blood vessels enter, and osteoblasts make bone in the center. Osteoclasts form the medullary cavity. Secondary ossification occurs at the bone ends. Finally, cartilage remains at the growth plate and joints. That brings us to the end of today's lecture on the anatomy of bones. Thank you for watching. If you found this lecture helpful, don't forget to like, subscribe, and hit the notification bell so you won't miss future lessons. Keep learning, stay curious, and see you in the next session.